This is a story of awakening. Chida choose that anorexia nervosa is not about vanity, but survival. It is a severe mental illness that hides beneath control, silence, and fear. In this presentation, I explore how evidence, trauma-informed care, and my SNARK 206 mental health nursing care learning reshape understanding and empathy. Anorexia nervosa is a descent into obsession, fear, and distortion. People severely restrict food intake, causing dangerous weight loss and malnutrition. Even when underweight, they experience an intense fear of gaining weight and distorted body image that controls their daily life. The Butterfly Foundation and National Eating Disorders Collaboration report that this illness has the highest mortality rate among all mental disorders. It is not a lifestyle choice. It's a psychological prison that consumes both body and mind. Australia holds a mirror to its own silence. According to the National Eating Disorders Collaboration, about 1.1 million Australians live with an eating disorder. Among them, 3% suffer from anorexia nervosa, and approximately 80% are female. Yet the barriers to treatment aren't only cultural. Structural and systemic obstacles matter greatly. A recent study by Spill and colleagues, 2025, found that when clinicians receive training and supervision, the knowledge, skills, and willingness to treat eating disorders increase significantly. But many health services face lack of funding, staff shortage, limited organizational support, and other structural constraints that prevent these capacities from translating into broader access. That's why less than a third of people ever receive the help they need, because when the system itself is constrained, stigma is only one part of the delay. The roots of anorexia are deeply intertwined. Biologically, research from the Eating Disorders Genetic Initiative shows strong genetic heritability. Psychologically, perfectionism, anxiety, and low self-worth create vulnerability. Social cultural pressures, from media, fashion, or sport, idealize thinness and reinforce guilt around eating. Studies also show that around 20 to 40% of women with autism meet the diagnostic criteria for anorexia nervosa, revealing how neurodiversity intersects with vulnerability. These findings remind us that no single cause defines this illness. It is a complex, multifactorial condition. FBT is first line for teens parents guide meals and weight recovery. It works well but can strain families. CBTE helps change unhelpful thoughts and habits. It's structured, Medicare covered, but less trauma-focused. For adults, SSCM offers flexible, supportive care like CBT, but less directive. Mantra targets thinking and relationships with carer input. It's person-centered, but needs trained therapists. Most recover through community care, with hospitalization only for medical risk. Every wound tells a story. About 90% of people with mental illness have lived through trauma. For many with anorexia, food restriction becomes a way to numb pain and regain control. Trauma-informed care recognizes this link. Treatment must feel safe, not punishing. Safety, empathy, and collaboration are essentials for healing. Up to 30% of people with anorexia experience psychotic symptoms. Yet few guidelines address this overlap. Dr. Rosier's 2024 study warns that fragmented care leads to misdiagnosis and slower recovery. Integrating trauma-informed and neuro-affirming care, grounded in lived experience, helped rebuild trust and reduce fear between clinicians and parents. Through this journey, I've discovered that anorexia nervosa is far more than an eating problem. It is a biological, psychological, and social illness, shaped by trauma, culture, and identity. My major findings show that early intervention and trauma-informed care can significantly reduce harm. Family and community involvement are crucial, and the recovery must be personal and help-driven. Starting SNAC 206 mental health nursing care transformed how I see anorexia. I moved from seeing a disorder to be treated to seeing a person to be understood. The subject taught me that effective nursing is not about control, but connection, listening, empathy, and respect for each person's story of recovery. Thanks for listening. That's the end of the presentation.